Hello, my name is Christine Miskonoodinkwe Smith. I'm originally from Peguis First Nations, but I've resided in Ontario since the age of 3 years old. I do freelance writing, editing, and blogging for various First Nations media outlets. I'm reporting this local story from Toronto for Friends of Canadian Broadcasting, and it's on Ontario Regional Chief RoseAnne Archibald from the Assembly of First Nations with her viewpoint on how COVID is affecting Indigenous communities.
My name is RoseAnne Archibald, and I am the Ontario Regional Chief on the Assembly of First Nations Executive Council.
What can you tell us about how COVID is affecting Indigenous communities?
Most First Nations are in lockdown, so they have road restrictions on their communities, or they are limiting the number of flights if they are a remote community. We know 12 communities have airport restrictions and flight restrictions into their communities. Many of them have checkpoints as you go into their community, and many of them have curfews. So the first response, what my staff in my office like to call a shield of protection, has been initiated in First Nations, and this has resulted in lower than expected numbers during this first wave, and we have been acknowledged by federal and provincial government as having lower than anticipated numbers. Nevertheless, we have had 2 deaths on reserve and 2 known deaths off reserve. So it's definitely impacted our communities. Because our communities are small and tight-knit, the impact is greater. So when a person dies in our community, it has a bigger effect than, say, one person who might die in the town of Cochrane or the city of Timmins. These have big impacts when people die, and certainly when people's health responses or their health is not good, that impacts the community as well. So COVID-19 as a disease is having a small impact in this first wave, but nevertheless is causing difficulties in our communities.
So what are you and the AFN, or you specifically, doing to address the needs of Indigenous communities during this pandemic?
Well, first of all, the AFN has a task force, and the AFN also passed a motion, we did as an executive, calling for a state of emergency for all First Nations. And so that's the national picture. And so we do have a national task force looking at issues in a broad sense and a high level sense nationally. In my office particularly, what we've been doing is tracking data. So we have daily reports on the number of cases in First Nations, and that's based on First Nations reporting those numbers to us based on public health units giving those numbers to the First Nations. So that is how we're tracking the virus and the spread within our communities. We do have 11 communities that have had the virus. A number of them are now back to 0 new cases and 0 active cases. And so we track that data so that First Nations can know how to respond in terms of whether they need to ramp up their efforts, lock down further, restrict more travel. That information is key for First Nations leadership to make decisions on how to proceed through the pandemic.
How are you personally dealing or coping with the COVID pandemic?
I go walking every day on an empty side road here in my territory, Tequatagamo territory, our traditional territories. Just the town of Cochrane is sort of in the heart of our territory. So I do things like that. I go walking with my sister's dogs, and I've done a lot of online and remote group therapy. I've really done a lot personally to maintain good mental and physical health so that I can be of service to the people that I've been elected to serve.
What changes do you think we will see in Indigenous communities once the emergency measures are lifted?
Well, we've had an opportunity over 2 months to change our behaviors and to really practice physical distancing and social distancing. And we've also had an opportunity to practice all of the health measures like washing our hands regularly, disinfecting surfaces, staying home. We've had this time to really have new habits, and we have to take those habits all throughout the pandemic, whether the society is open up or not, or whether the economy is open or not. And it is my goal in my office. I did set some pandemic goals, and my highest goal is to preserve health and save lives of First Nations people. That's my highest purpose. And then my overall goal is to have zero new COVID-19 cases in communities. And so we have developed the concept around every community, First Nation community in Ontario, having a COVID-19 community coordinator, and to have also that person would work with another concept we're building, which is a 24-hour coordinated response team. We're calling them STAT teams. And those STAT teams are really to help the community deal with an outbreak within the first 24 hours, which are the most critical. That's the most critical time. So we're building these tools and information so that First Nations can maintain and preserve health in their communities and save lives.
As an Indigenous journalist, I like to portray Indigenous people in a positive light. Indigenous people and community, we are resilient and strong. But is there an uplifting message that you could give to the general public about COVID and how we can keep going and also help each other?
A lot of the issues around COVID-19 are fear-based. And so I have been promoting a couple of things that are based in our culture. And these are things my mom taught me, that everything that is from the planet has a spirit, everything. And so that is coming from the earth. The virus comes from the planet. It comes from the earth. It's not something that's coming from outer space. It's actually from the planet. And it's here to teach us something. And we have to understand what those lessons are, ingest them, and move forward in a good way. And so there's been, as I said, a lot of fear around COVID-19 and the coronavirus. And so my message has been, again, something that I learned from my mom, is that we have to come forward from a place of love. And so it sounds counterintuitive to love the coronavirus that is here. That's the first thing we can do. But more importantly, we have to have a deep and abiding love and care for one another. And what that means is, as we think about health measures, we're not only thinking about ourselves, like I need to protect myself, we're thinking about other people. That coming from a place of love is essential right now. So they now say wear masks, which I have been promoting probably since March. And finally, and it's not just me, it actually came out of Taiwan, where they do prescribe masks to their people. In any case, when you're wearing a mask, you're wearing it to protect somebody else. You're wearing it to show love and care to somebody else, because you're keeping your micro droplets to yourself, which is one of the ways that the virus can spread. And so we have to culturally address this pandemic and this crisis from a state of love. And love is one of the 7 sacred teachings. And so we have to reach into our cultural toolbox as well in order to move through this pandemic in a good way.